IDS is a broad-based international development studies institute, kind of 300 or 400 partners every year in institutions across the world, and a lot of our interdisciplinarity with the natural sciences, with climate scientists, with health scientists and so on comes through those partnerships. In 2014, we created our first kind of 5-year strategy, which has transdisciplinarity at its heart. And we talk about these 4 pillars, but them being completely interdependent. So one is about high quality research, which is always multiple disciplines, multiple methods. Co-constructing knowledge, so that's the transdisciplinary bit. It's working with civil society, with governance, with other stakeholders. It's mobilising evidence to have impact, and co-construction is absolutely critical there. Just yesterday we had a fantastic seminar about understanding health systems as complex systems, and some rapid participatory work which had been done with policymakers and actors. This interestingly, I mean, it was also an example of how you do this very rapidly. In fact, the researcher was just in my office just before you came. She basically did a whole series of 2-week studies where she got a group together of multiple disciplines and kind of positions. So these were some health policymakers, service workers, nurses, doctors, and some academics, and they planned a series of questions and then went and investigated what the problems were, how the health system was operating, and where the policy, how policies were being implemented in practice, and standards and guidelines, and where the blockages were to address the issues, and took a system and basically did a rapid participatory complex systems approach. And has revealed all kinds of points of entry, reasons why antibiotics were being overprescribed in certain areas than others. And she's managed to publish this in the BMJ, which is really interesting. I think it is the future, but it's very difficult, and we reflect in some of this work on some of the challenges of making this work in practice. And I think, and some of them are really quite practical, and they're about, you need good facilitation, you need patience, you need time, you need to learn each other's languages, you need to realise that policymakers and academics are often working to very different incentives. You need to try and get these aligned and have something that interests everybody.
So my research is focusing on the area of agri-food systems, and at the global level the challenge is really around providing enough and distributing enough food for everyone on the planet within planetary boundaries. But that translates down to the local level, in Brighton and Hove, thinking about more local systems of production that can feed the city. And whilst other colleagues have looked at urban food production, community growing, we decided in our project to look outside the city to the peri-urban area and the smaller producers that live and work around the city of Brighton and Hove. Yeah, so I think that the main contribution of the social actors, firstly, they told us what they thought were the questions that needed to be
addressed.
Yeah. Yes. They also pointed us towards people that we would need to speak to. But the most important thing, and I think this is happening now and will happen, is that they are the route through which the knowledge is embedded in processes which are underway anyway. The discussions that we had fed into an ongoing initiative which is associated with the Brighton and Hove Food Partnership, pulling together a citywide food strategy for the next 5 years. That was something that started independently of the project, but in the early stages of the project, and they used our work and our event to inform part of what they wanted to do, which was to extend the vision of the city's food system beyond the city itself to the surrounding area. So I think that it's that provided an impulse for local change.